So next we can see CPR procedure for infants. The age group is below 1 year. Okay, so below 1 year we can call as a infants. Okay, so if you notice, if the infant is unresponsiveness, or else not breathing normally, or else there is no signs of life, then immediately follow these all the guidelines. We can save the infants. Okay, first we can see, check the responsiveness. Okay, and tap the infants gently on the foot. Then ask loudly, are you okay? Are you okay? And check for any movements are present or not. If there is no movements, and immediately call for helpline. Okay, so next step is check for breathing. First open the airway by the head tilt and chin lift method. Then after that, look at any obstruction is present or not. If any obstruction is present, clear the obstruction. Okay, so next is look, listen and feel for breathing. Okay, for the 5 to 10 seconds. Then after that, if there is no signs of breathing, okay, if you notice there is no signs of breathing, only gasping, then immediately start the chest compressions. Okay, so while providing chest compression for infants, you must remember these all the things. Okay, so because the chest compression, providing chest compression for children and infants, there is a little difference is there. Okay, so you have to follow these all the guidelines. Okay, first we have to, while providing chest compression, first place the infant on the flat surface. Okay, then after that, locate the center of the chest just below the nipple line on the breastbone. Remember, locate the center of the chest just below the nipple line on the breastbone. Then after that, use your 2 fingers. Okay, that is index and middle finger, and for the chest compression. Okay, if it is one rescue CPR means by the 2 finger technique we can give the chest compression, that is index finger and middle finger. Okay, if it is 2 rescue CPR means, okay, use the 2 thumb encircling hand technique. Okay, so it can provide the better quality chest compressions. Okay, so remember the chest compression ratio is 30 chest compression and 2 breaths if it is 1 rescue CPR. Okay, so if it is 2 rescue CPR means the compression ratio is 15 chest compressions and 2 rescue breaths. So remember, if it is 1 rescue CPR, 30 chest compression and 2 breaths. If it is 2 rescue CPR, 15 chest compression and 2 breaths. Okay, so next is the rate of chest compression are per minute 100 to 120 chest compressions per minute. Okay, and depth of the chest compression for infants is approximately 4 centimeter depth. Okay, approximately 4 centimeter depth or 1.5 inches depth. So this is most important. In case of child CPR, the depth of chest compression is approximately 5 centimeter. Okay, or else 2 inches depth. Okay, in case of infant CPR means the depth of chest compression is approximately 4 centimeter depth or else 1.5 inches depth. This difference you have to remember. Okay, so after that, then chest recoil must be allow. Okay, between each chest compression, allow the chest recoil. Then we can do like this, means we can improve the blood circulation. Okay, so we can follow this high quality CPR guidelines, means then improve the blood circulation for vital organs. The CPR procedure guidelines are different for adults, children and infants. Okay, so these are all the guidelines we need to follow, then we can save the adult, children and infants life. Okay, thank you.